Bethanie Clinic at the moment is the only facility around this area. The nearest hospital is about 50 kilometers. And we have a catchment area of about 22,000 people, which is quite huge.
Most of the people are affected by poverty. Unfortunately, I think it's the way that apartheid and the change of the new government left the people unequipped. I had a patient that she was 18 years old. She came to the clinic on her own. She sat in the queue patiently waiting for her turn. Didn't say, "I'm feeling really bad." She collapsed and she passed away. She was HIV positive. I am not sure exactly what the cause of death was, but she was really in a bad condition. And that shook me, that someone can just be satisfied sitting in the queue, patiently waiting because they are not used to better care. And I think that's really something that needs to change.
Just open the tummy only.
At Bethanie Clinic, I mostly see chronic patients with hypertension, diabetes, HIV, TB. We also have an emergency unit. I know I am more privileged than most of my patients, and I know my background put me in that position.
Okay, let's
Examine baby. But I think if you make an effort to show the patients that you understand them and you can communicate with them, they kind of accept you.
Thank you, my darling. You can get dressed. We'll just make a note in your book.
I think it's just seeing yourself as a human and that you are not any different from any other human.
At the moment, we have people from the mines, but we also have a lot of elderly patients. People are not working, and these people don't have any other facility. The mine will not continue to maintain this facility forever. In time, they will hand it over to the government. The health of the population should belong to the government, not to private institutions. In a way, government should take their own responsibility and look after their own people.
The access to healthcare is quite difficult. That's why I think it's good that the mines help us a bit. Strong people have to step up and take responsibility for our country and really decide, it's me, I'm going to make a change with the few resources that I have.
Let's use the hospital example. Do we have the right skill set in the region to ensure that that hospital remains intact in the same way as Glencoe has left it? I think that beefing up needs to happen at municipal level because that's actually where the delivery is at.
As an athlete, it's much easier to have a clinic, Bethanie Clinic. You have to always be healthy. You have to always know that what kind of sickness you have, so that there are kind of sports that you can do or you cannot do.
Private-public partnerships would be great, only because I think that the private sector cannot just operate alone.